It's that time again. Let's prep for boards. Welcome to Board Prep Bites, where I post one board question, provide a rationale, and make you more board ready. Here's today's question.
A 76-year-old patient presents for knee arthroplasty. The plan to use spinal anesthesia will need to be reconsidered if which of the following diagnoses is discovered on review of the patient's medical history. Pause the video here and select your answer.
And the correct answer here is C, aortic stenosis. Spinal or epidural anesthesia should be used very cautiously in patients with mild or moderate aortic stenosis because hypotension readily occurs as a result of reductions in preload, afterload, or both. Spinal and epidural anesthesia are contraindicated in patients with severe aortic stenosis. So a quick lesson on aortic stenosis. The stenotic valve in the aorta creates a fixed obstruction to left ventricular outflow. The left ventricle cannot significantly increase stroke volume to compensate for changes in decreased preload or afterload. So cardiac output becomes preload and afterload dependent. So when SVR and preload drop, cardiac output falls, coronary perfusion pressure drops, and can lead to myocardial ischemia, ventricular arrhythmias, cardiogenic shock, and cardiac arrest. No bueno. So just remember, these patients rely on adequate preload, SVR, and sinus rhythm. All the other options are not considered contraindications to spinal or epidural anesthesia. Hope this was helpful. See you next week for another Board Prep Bites.